We are changing our inpatient visitation guidelines at UW Medicine as well as our outpatient guidelines. And here at UW Medical Center, we're going to be allowing 2 inpatient visitors, I should say 1 to 2 inpatient visitors, depending on the space. And clinics get 1 outpatient visitor. There are some clinics that may have a slightly different policy, for instance, transplant clinics or rehabilitation clinics, which may be allowing 2 visitors. And we think this is a really important way to protect vulnerable patients and our healthcare workers. So folks are required either to be vaccinated or to show proof of a negative test within 72 hours. And there are a number of ways that you can show proof of a negative test. So you can bring in the test, you can have a photo of the test with your name and the date on it, or you can show a digital copy of the test. This visitation process started actually well before Omicron and has already been rolled out at Harborview Medical Center, and actually the reception has been quite positive for staff and for patients. But we think that this adds another layer of protection, for our vulnerable patients and for our staff.
Hola, buenas tardes. ¿Cómo están? Muy bien, bienvenida a la clínica.
Bottlenecks are a good question. Thankfully, we've gotten very used to screening throughout the past 2 years, and I think with the help of additional screeners and a wristband system, we're very hopeful that this is not going to lead to longer lines at the front door.
Finger stick, y así está usted del restaurante o del avión o lo que sea, y no tiene usted que sacar.
If somebody does not have a negative test or is unvaccinated, they will be turned away, but we would encourage them to get vaccinated, and we're happy to offer that. We also are hopeful that we will have either rapid testing available in pharmacies nearby or in many of our sites that are either on campus or in the community where they can go and get a test and then come back when they're ready. Yes, so there are a few exceptions that I'd like to mention, and I'll just give you some examples. I like to think about it as, people at the beginning of life or the end of life. So if a woman is in labor, we want her to be able to have support members or family present. Similarly, if there's an urgent end-of-life situation, we want people to have their friends and loved ones be able to visit. I would refer people to our website that has full versions of the policy, because there are a number of other exceptions, and that may help answer questions that people have. We also have translations on the website that may be helpful. So Omicron has not affected our masking policy, and I just want to reiterate that Omicron is not a new virus. It's just a variant of the same virus that we've been dealing with this whole time. And so our masking policies, if anything, we're just trying to elevate our standard masks. So when people come in to the hospital, we want everybody to be wearing a hospital-grade mask, which we will provide. If people want to wear a cloth mask, they're welcome to, but they can put the medical mask over it. If people want to wear an N95 or a KN95, some of those higher level respirators, that's fine, and they're welcome to do so. Here at UW Medicine, I think we're very prepared for Omicron or any other variants. And just to reemphasize that, this is not a new virus. It's the same virus that we've been dealing with. And so we expect all of our mitigation measures, masking, distancing, and even vaccines to have a significant impact in curtailing Omicron or other new variants. We're also very, very lucky that our lab has excellent testing capacity and is able to quickly screen for new Omicron cases as well as sequence them.